Hey, how you doing, Serena?
Good. How are you? Thank you for joining. Thank you for joining early. We
Thank
have
you.
tons of people that are already on because everyone wants to know how they can support their own immune system, but obviously how they can support the immune system of others, the people that they love, and about this journey that you have where you are using this product to help save millions of children across the globe. So just all over the world.
Exactly. Perfect.
So are you good? You're situated? It looks like you've got good Wi-Fi. I love all the hearts. That means they can see us and they can hear us well. We're not pixelated, right, you guys? Send hearts, let me know. And, of course, always let us know where you're joining in from. Oh, good. Okay. So Healthy Girl now says that gave us the hands up. So that means we're all good in terms of the Wi-Fi. So Sam, I give a very, very brief introduction that really does not capture everything that you've done because you've done so many extraordinary things and so many things that are beautiful and philanthropical. But could you at least give everyone just a little bit of background on how you started with this, just a snippet into that journey so that people can understand what Ace Menin is and what you're doing with MannaRelief?
Yeah, absolutely. Well, thank you. And thanks for allowing me to share this incredible story.
Oh, yes. I'm so happy you're here. I mean, it touched my soul. And it's so synergistic that we were connected. And I think that was really meant to be. And, when people talk about your vibe attracts your tribe, it's just, how important service is to me. And just with integrative health and nutrition, right. It's so synchronistic. So I just interrupted you. I apologize. Yeah, go ahead.
Well, this story started for me, like you said, I have been sort of an entrepreneur of disruptive technologies. Those are technologies that challenge status quo in a lot of different industries. But in 1993, I was introduced to a company here in Dallas. It was called Carrington Laboratories. And was a pharmaceutical company that had made the discovery of the biologically active molecule in the aloe vera plant, that it was actually responsible for its rich history as a healing plant. It turns out that the molecule, which is called Ace Menin, was a labile molecule. It's a polysaccharide. And within about 24 hours of the time the leaf was picked, it completely denatured. In other words, it was gone.
Right.
Well, this group of investors that took the project to Southwestern Medical School here in Dallas, to the Department of Research Pharmacology, and said, there's something in the fresh gel of aloe vera that causes a very profound immune response in human physiology, but it's labile. And we would stabilize it, but we don't know what we're looking for.
Right.
Could you guys help us? And they're the ones that identified that it was this very uniquely structured polysaccharide. Poly means many, saccharide means sugar. It's a long chain sugar, but a very unique sugar in nature. It's made up primarily of a monosaccharide, an individual sugar that is called mannose. And just to kind of give you some perspective on this, the mannose long chain polysaccharide only exists in two things in nature. One is aloe vera gel. The other is human breast milk. And I just found that fascinating.
Oh, no, absolutely. And people know how, some people call human breast milk liquid gold. They can, so many things. I actually had a girlfriend who her baby had a eye infection, and she literally put breast milk in her child's eye, and it was gone by the next morning. The infection or irritation was gone by the next morning.
So when a woman becomes pregnant, she starts converting high levels of glucose to this monosaccharide called mannose, because it's essential for a proper functioning immune system, and that's how a baby, starts developing a good functioning immune system.
Right.
In fact, when a woman becomes pregnant, if she has an autoimmune disorder, a lot of times she'll go into complete remission until she is finished with her pregnancy, right?
Right. And that actually happened with another girlfriend of mine. Her autoimmune symptoms all went away while she was pregnant, but when she was done breastfeeding, it came back. So,
well, that's because of this uniquely structured polysaccharide. So once they discovered it, they determined how to stabilize it for the first time, filed and received about 150 patents. And their goal was to bring it into the marketplace as a drug for humans. And they went into different vertical markets of healthcare. They had done advanced wound care because it accelerates wound healing.
Yes.
About 7 times faster than normal physiology. But the big brass ring was a human drug for strengthening the body's immune responses to cancer, to autoimmune disorders, to infectious diseases caused by viruses and bacteria. Because what ACE-Mannan does, its mechanism of action, is it activates a large white blood cell in your immune system called a macrophage. Now, macrophage is like the front line of defense. And when that gets activated, it increases the production of stem cells, production of T cells, natural killer cells. So in other words, it just alerts the whole immune system that something is going on that needs to be addressed.
Right.
And so that's what ACE-Mannan does, and that's why it works so well. Okay, so they submit their new drug application to the FDA. Now, it had already been approved as an immunostimulant for the treatment of cancer in animals, but that's the USDA.
Right.
Medicine. That's the United States Department of Agriculture. The FDA said, in order to get a drug approved for humans, you have to be able to show that it alters the physiology of a disease process or a biomarker of disease. And your molecule doesn't alter physiology at all. It supports physiology. So it's not a drug.
Right.
That was a blessing to me.
Absolutely, because we're trying to do things as holistically as possible. So
we talked about that.
Yes.
And so once they got rejected, they had no idea, again, because they're a pharmaceutical company, how to bring a nutritional product into the marketplace. And so I met them in 1993, looked at their technology. They had already done about $100 million worth of research on it at that point. And I thought it was it was just incredible. And so anyway, I licensed the exclusive rights to that and started marketing it around the world. But what I found real quickly is that those that responded the quickest were those that were the most severely health challenged. And I was in Romania, and my wife and I were adopting children, and I was talking to the head caregiver of this organization, and she said, it's just heartbreaking to see what's going on with our children. They're sick all the time. We're losing 30 to 40 kids a year.
Wow.
And if anybody knows anything that could help us, let us know. And I said, why are your children dying? She said, well, they're malnourished. They're exposed to poor sanitation. Both of those things compromise their immune systems.
Yeah.
And when they become immunocompromised, they lose the ability to defend themselves against infectious and chronic diseases.
Sure.
And so our kids get sick and they just never get better.
Sure.
And I said, well, I think I have something that will help.
Yeah.
And so I sent her ACE-Mannan. It comes in a powdered form. They just blended it into the food. The end of the year came and she said, you're not going to believe what's happened to our children. Thousands of kids. She goes, for the first time in over a decade, not one child died in our organization. And we've been losing dozens of children every year. So not only do we want it, but everybody we're networked with in the orphanage industry wants to know how they can get access. Because it is the opposite of trying to manage the symptoms of chronic disease through drug therapy.
Right.
I mean, that's what modern healthcare does, Serena.
Yes.
If you've got an autoimmune, then you get an anti-inflammatory drug. You get a pain drug, whatever. You get a steroid shot to manage the symptoms of chronic disease.
Right.
This is just the opposite. This is a technology that supports your body's normal functions of defense and repair at levels we've never seen in modern medicine. So
and it's all natural. and it's all natural. And just for now that we're about 10 minutes in, I just wanted to share with people who kind of jumped in after you started what we're talking about today. And we're talking about this product called Ace Mannan, which is from the aloe vera plant. And Sam had kind of given a very simple scientific breakdown of how it works, but that this and what would you call it? It's a polysaccharide, but how would you best categorize it for people who are listening out there? Like what is it exactly about the aloe vera plant that this polysaccharide? What would they call that?
It's a carbohydrate.
So it's a carbohydrate.
Mm-hmm. It's in the carbohydrate family. So it's a polysaccharide is a long chain sugar. But again, it's this unique sugar that doesn't cause a insulin response in your body.
Right.
It has a completely different mechanism of action. It activates your immune system instead of your blood sugar levels. Mm-hmm. So it's one of those unique molecules in nature. The more I studied aloe vera, the more I realized that ancient medicine classified it as the cornerstone of ancient medicine in all cultures of the world. Yeah. Because there was a profound impact through the gel of aloe vera that they couldn't achieve through any other form of intervention.
Right.
And so natural, non-toxic, way of activating your immune system. That's what it does.
Yeah, and I share quite often that I use aloe vera every single day. I have a little shot of it every single morning in my elixir that I make. Although this is Ace Mannan is much more potent, much more effective than just a shot of it. And Sam, would you just mind, just for the people who jumped on late, explaining what the difference of it being fresh to bottled, how it denatures and how that diminishes its potency?
Yeah, so when you pick an aloe vera leaf, an enzyme is activated that starts breaking down this polysaccharide because it is the carbohydrate structure that holds the gel intact. Mm-hmm. And so within 24 hours, you lose the complete activity of Ace Mannan. In other words, its structure is
24 hours.
24 hours. And so when Carrington Labs first made this discovery, it turns out that not one aloe vera product had stabilized Ace Mannan in it anywhere in the world, because nobody even knew to stabilize it.
Right.
So they received about 150 patents around the world on that processing technique. So, there's a lot of good ingredients in aloe vera.
Yes, a lot of benefits. Mm-hmm.
But Ace Mannan is by far the active ingredient that is responsible for its rich history of healing. Because that's what it does. And so when I decided to pursue a global distribution, I met with one of the researchers that had developed the stabilization process and told him what I wanted to do. I said, I want to create a social business that allows me to distribute this technology into the marketplace, because consumers worldwide have the same health challenges that people do anywhere in the world.
Yes.
And in fact, 60% of the people who live in our country, Serena, suffer from one or more chronic conditions.
They do. It's very true. I see them with my clients all the time, and this is something that can literally transform their lives.
Yeah, and so what that means is they have compromised immune system, so they wouldn't be sick, because your immune system is designed to keep you healthy.
Yes.
Anyway, so I met with one of the PhDs that had designed the first stabilized Ace Mannan, and told him about the project, social business, which is every time I sell a product, I donate the same amount of product to a child in need. So that creates a sustainable funding mechanism for my not-for-profit. And he developed a new class of Ace Mannan that's about 4 to 5 times more potent than the original that we started with 20-something years ago.
Yeah.
And we just introduced that to the market just a couple of months ago. So, we're getting better at what we do, which means we're getting faster and better results from people. And, millions of people will go tonight praying that God will bring a solution to a health challenge that they are facing, their child, their parent, their spouse. and that there's no good solution for in medicine. And what we have learned, in fact, the cutting edge of medical research has learned that the best mechanism for fighting things like cancer is the human body.
Absolutely. Our bodies are incredible machines. And, I talk about that all the time. It's just that sometimes we need a little bit of help. We need a little bit of guidance. And this is something that is natural. It works synergistically with our body. It doesn't, there's no toxins in it like how there is with other types of medication, and it can actually heal the body. So something that you haven't said that I need to share with the audience is that in 2018, so this is, we're just shy of 3 years ago, MannaRelief actually exceeded 100 million servings of donated nutritional support since its ability to help children in over 90 countries. So Ace Manna, you've brought Ace Manna in, and you've served over 100 million servings of Ace Manna through these products to help save children. So that's just something that I'm probably going to say again during the course of this hour, because you didn't share that. And it's something that's look at all these hearts. That's something that's so important for people to know and to understand, not just what you're doing, but just the healing power of what you're using. And so it's like a two-part thing. It's the simplicity of the product that you have, and how many lives that it can save and benefit and help, but also what you're doing with it. Yeah. Wow, thank you, Courtney. It's 135 million now. So in the last 2.5 years, so we're now up to 135 million servings of donated nutritional support. And this is because you had the mind to think, okay, I'm going to do this through social entrepreneurship. I'm going to create a structure where I can support the not-for-profit. So can you just dive into that a little bit more, Sam? So, because I know there's a lot of people out there who don't even understand what social entrepreneurship is, what that structure is like, and just, and I'd love to actually talk a little bit about these products. And if you could share some of the stories, because I know that you have so many inspiring stories to share with us.
Well, social entrepreneurship was started in the 80s by a man named Mohammed Yunus. He was a banker in Bangladesh, the poorest country on the planet, and realized there was nothing really good going on to solve the problem of poverty. And his belief was these people don't want to live in hopelessness and despair. If they had a chance to work themselves out of it, they would. So he created a banking instrument called microfinance, microloans. And what he would do is put people into business for as little as $20, $25. And what came of that is that he impacted the lives of about 40 million people in Bangladesh through microfinance. And he ultimately won the 2005 Nobel Prize and launched a whole new industry called social business, social entrepreneurship. And it's really entrepreneurs that are dedicating all of their resources of capital, technology, experience to start for-profit companies to leverage the economic power of the marketplace to bring sustainable change to the world's biggest problems. And I was invited to go to the first international symposium on social business in 2012. It was hosted by the former president of Mexico, Vicente Fox, and he had Mohammed Yunus as a guest speaker. And one of the things we looked at are what are the biggest challenges that we face in the 21st century that we are not adequately finding good solutions for. And the number one that the group came up with is modern healthcare. And they said this business of medicating chronic disease is unsustainable. It's going to break the economies of every country in the world, and it really doesn't provide good patient outcomes most of the time. So we need to disrupt that way of thinking, and the best way to do it is find technologies that can enhance the body's ability to heal itself. And, of course, one of the things that was so unique about that situation is that President Fox had been distributing our Ace Mannan product in Mexico with his wife, Marta, for over 10 years.
Wow.
And so that's why I was invited to the conference, to provide this new natural patented technology that could dramatically impact the lives of the world's most vulnerable children. And to create sustainable funding for that, Serena, we decided to start a social business so that we could make our products available for the first time to people all over the world, and link the sale of those products to the needs of children. So instead of being a for-profit that started a not-for-profit, we were a not-for-profit that started a for-profit.
Right. Well, that just gives people kind of a breakdown and some background on why you structured it this way and how it works. And, we have so many questions that have come in actually even before you got on, when I had promoted that we were going to be talking during this hour. People really want to understand how Ace Mannan influences the body's immune system. Like, can you,
Yes.
I know you've already given, we've kind of covered it a couple times, but I mean, It's just something so new. People don't understand how does it resist the virus? So how does it fight against it, especially in COVID?
Yeah, so for instance, a study was done a couple of years ago on Ace Mannan with influenza virus. That's the flu. Okay. And so here's what they were looking for. Typically, when you say an immune booster from a nutritional standpoint, you're talking about things like vitamin C or zinc or herbs like echinacea. And essentially what they do is they properly nourish the body. And a well-nourished body, has a good functioning immune system. That's not boosting your immune system. That's supporting your immune system.
Exactly.
So to boost it, what you do is you have to activate the master regulator of your immune system, which is called the macrophage. So that's a large white blood cell that orchestrates all the immunomodulatory functions of everything that goes on in your immune system. And what activates it is Ace Mannan. And it's kind of interesting. On the surface of cancer cells or viruses or bacteria are these little structures of mannose. In other words, the same little structures that we're talking about exist on viruses and bacteria. And that's how the immune system knows there's a problem. And so it sees.
Oh, we lost sound. Let's see.
On influenza, they looked at three things. Number one, could the intervention of Ace Mannan lower the infection rate of the virus? And the answer was yes, because it suppresses the ability for the virus to adhere, to a cell and actually penetrate. The second thing we looked at is, could we lower the actual viral load in the body through the intervention of Ace Mannan? And the answer was significantly. And then the last thing they looked at, because these respiratory viruses cause death as a result of an overactive immune system. Once the immune system figures it out, like it's called the cytokine storm.
Yes.
Could it help reduce the effects of the dramatic negative impacts on the human body? And the way they tested that is they gave laboratory mice lethal doses of the influenza virus, and then a placebo, and then another group, which means just a sugar pill. Then the second group, they gave lethal doses along with Ace Mannan intervention. So the group that got the lethal dose of virus and a placebo all died within a day or two because it was lethal. Body can't deal with it. Those that got the Ace Mannan intervention with that same exact lethal dose had a 70% recovery rate. So by activating the master regulator of defense, you turn on all the immunomodulatory functions of the immune system, and that's how it works.
So I hope that you guys are taking notes, and just to repeat what I say every single live. Yes, we will. This is recorded. We will clean up all the audio and video, and then we will we will relaunch this as a replay. So don't worry if you missed some of what Sam said, but just to sum up, ACE Manna's influence on the body's ability to resist different viruses is that they help resist the virus's adhesion to certain host cells. Is that correct?
That's
Sam?
exactly right.
Okay, so basically the ACE Mannan inhibits the penetration. So that's one way, and so it can reduce the viral load, right?
Yes.
In the body, and I think there was something specific that someone just said, is this a study people took you did reference a study. Could you reference the study again, or just let us know the name in case people want to look it up and learn more?
You know what? I could. I just don't have it in front of me.
Okay.
I'll be glad to
Okay,
see
you guys.
it.
Go ahead and send Sam a message after this. Go follow him on his Instagram account. I have it pinned on the very bottom of the comment here, and it's on my stories. Again, we'll also, we've shared his post. We'll share it again, but make sure you go and follow Sam. And you can follow MannaRelief Ministries, and he's going to talk a little bit more about this nutritional product that ACE Mannan is in, and you can go follow that account as well. But follow these accounts because you'll get all the information and access to the science behind it and everything that Sam is doing, which is profoundly healing, not just for us, for you and I, but for so many out there in the world that really need the help. So that's one of the ways that several of the ways that ACE Mannan helps with the body's resistance against viruses. Some people have questions about COVID specifically, and I'm not sure if you can talk about that, Sam, but I know that you've definitely had some findings with ACE Mannan and the coronavirus.
Well, so what you need to understand is that this is not a drug,
right?
First of all, so it doesn't attack the virus,
right?
ACE Mannan
blocks.
Mm-hmm. Yeah, what it does is it turns on your immune system's response to a virus. Mm-hmm. And so it really, like for instance, if you take a vaccination, the challenge with the vaccination, number one, it's toxic. And, that's a different subject for a different day.
Yes.
The second problem is that viruses mutate.
Yes.
Just like bacteria do.
Yep.
And they become drug resistant. Mm-hmm. And so every year they change the flu vaccine. Why? Because it doesn't work anymore.
Right.
And it gets about a 40%.
We don't take it.
It gets about a 40% protection rate.
Right.
Because it's always mutating. And so then what people are trying to evaluate is what is the downside of getting a vaccination versus the downside of potentially getting the flu. Mm-hmm. Well, all of that is irrelevant if your immune system is working appropriately. Because your immune system is non-specific to the viral component. Doesn't matter if it's influenza. Doesn't matter if it's COVID. It doesn't matter if it's a retrovirus. Mm-hmm. The immune system can see a virus, regardless of its mutation, generation, and destroy it. That's what the immune system does. Drugs are specific to a particular iteration, for instance, of a virus. Mm-hmm. And if you think that it is challenging what is going on in the world today with viruses, what is coming from bacterial infection, it could be 10 times worse.
Right.
Because bacteria are also mutating around the antibiotics,
right,
and becoming drug resistant. Last year, 750,000 people in the world died of drug resistant forms of bacteria. They're predicting in the next 20 to 30 years that'll be 10 million a year. And they said the only thing that we have short of developing new, more potent drugs is to turn on our immune systems. Mm-hmm. Because our immune systems have the innate capacity to protect us against any kind of viral or bacterial infection.
Absolutely. And this is just, and again, as I'm repeating myself, but our bodies are incredible human machines, and we're built to heal ourselves, and we're built to defend against viruses and bacteria. But sometimes we need a little bit of help, and this is an incredible natural form of help for our bodies. So, again, we're at the half an hour mark, and I want to just reintroduce again, what we're talking about, so that there are people who joined on late, some people pop in and pop off, but we're talking about ACE Mannan. which again is a molecule in the aloe vera plant that is incredible for our immune system. And Sam, who's my guest today, Sam Castor, has found a way to put this product, this Ace Mannan, into these nutritional products that he's now using to save millions of children across the world. So, Sam, can you talk a little bit about these products? And actually, I would love if you could share just a couple of stories that you've had, your firsthand experience with some of these children and their healing abilities when they're given Ace Mannan.
Well, it's interesting. When I first started distributing the product to orphanages, of course, we went to some of the world's most challenging places like Africa.
Yeah.
And that's where kids were dying of a lot of different things. AIDS, of course, was a big deal. So many children were born with AIDS because it was wiping out adult populations like crazy. And so AIDS is a virus. And one of the challenges with AIDS is it mutates so fast, it's hard to develop a drug to fight it.
Right.
But again, that's not a challenge for the immune system. And so one of the very first, very profound responses that we saw was the quality of life impact on children suffering from AIDS. And by optimizing their immune system, all of a sudden everything changed in these kids' lives.
Right.
And again, it doesn't attack the AIDS virus. It turns on your immune system's ability to do what it's designed to do, which is see a virus and kill it.
Right.
And so what that translates to is just the impact on the child's quality of life is dramatic. But one of the things that surprised us the most is we did a clinical trial on a genetic disorder, which is called sickle cell in Africa. And, kids are born with it. It's a chromosome disorder that both the parents have to be carrying the altered gene. And how it manifests itself is that these kids, about 70% of them die before the age of 5. But if you live, you live a miserable life of pain. It's like having shingles 24/7, And it's just the most devastating, debilitating condition you could possibly imagine. Nothing touches it. And we had a medical doctor over there, David Ajabadi. I think you might have met him one day on the phone. And he did a clinical trial using Ace Mannan. 85% of the kids had significant response to it. And again, this doesn't cure a genetic defect. This optimizes the immune system's response to it. And so for the first time, you had kids living without pain.
Wow.
And we've seen that sort of thing here in the United States. In our MannaRelief program, we have a program called the HOPE program for medically fragile children. A lot of the kids have things that there is nothing in medicine that responds well to whatever their condition is.
Right.
One of the the number one killer of children in this country used to be cystic fibrosis until they came up with lung transplants. But a cystic fibrosis child average lifespan was 20 years. And we started intervening with Ace Mannan in kids with cystic fibrosis. And again, this doesn't fix that problem.
Right.
What it does is it optimizes the body's immune response to it, which meant all of a sudden these kids started leading a quality of life they had never achieved before. Their lungs started clearing up, their digestion system started working more appropriately, because again, your body is designed to heal itself.
Yes.
And this is just the most profound technology in nature for supporting those mechanisms of action.
Right. And just to kind of jump on what Sam said, we're really talking about optimizing your immune system. We're really talking about giving your body all the tools that it needs to kind of help heal itself. Now, he has this incredible product called Ace Mannan, but there are other ways, so as long as so make sure you're doing all the things, like taking care of, I know it sounds silly, but drinking enough water, making sure you're well hydrated, having a, good whole foods diet. I'm always talking about eating the rainbow, movement and exercise. These are all things that are all there they're not there. They're all things we do to optimize our immune system. So, Sam, a couple questions had come in just because people hadn't heard of Ace Mannan before. As you were speaking, my text messages were going off about how is this different than, let's say, astragalus. How is this different than, say, turmeric or ginger? There's a lot of other plants that have immune optimizing and immune supportive abilities because it wakens up your immune system, triggered to make sure it's alert so that it can fight the bad guys. That's kind of how I always break it down to people. So people just want to know, like, how is this different? I know the potency is there, but I'll let you go. Explain that.
Well, there's different classes of nutritional compounds or extracts that work differently. Sometimes, like in the case of turmeric, it has more of an anti-inflammatory response.
Right.
I mean, that's indirectly an immune response because what it's doing is it's lowering the chronic inflammatory response in the body. But that's not activating the immune system. That's going specifically towards a side effect of a dysfunctional immune system, which is chronic inflammation. Now, that's a good thing. There's nothing wrong with that. But that's a completely different mechanism of action.
Right.
Sometimes, like astragalus or beta-glucans or things like that will give immune support, or vitamins and minerals will. The thing that separates ace-mannan from everything else is its chemical makeup, its structure. It is made up 95% from a monosaccharide called mannose. And that is critical to its mechanism of action, because all viruses, all bacteria, all aberrant cells like cancer cells express like an antigen off their surface. And that antigen has a sugar structure on it, a glycan structure. And at the end of that structure is mannose. Now, mannose is what tells the immune system there's a problem.
Right.
So how does the immune system know a disease cell from a healthy cell?
Right.
If it has mannose on the end, and no healthy cells have terminal mannose on their glycan structures. So when ace-mannan comes into the body, it mimics a problem child. And so it activates the immune system immediately. And then the immune system engulfs it. That's what a macrophage does. Then releases these individual monosaccharides of mannose back out into the bloodstream. And the body loves mannose because it takes every cell of the body. So the big difference between ace-mannan and every other thing you mentioned is its chemical structure. It is made up of the sugar that tells the immune cell there's a problem.
So thank you for answering that, because I feel that anyone who is maybe a little bit confused, that really kind of succinctly ties it all together. Like, that's what makes this different. And that's what makes it so profoundly healing. We did have a couple questions that came in that I thought were really interesting. Is, can it overstimulate? Like what they were telling us, elderberries and the cytokine worms, and, can it also overstimulate?
The answer is absolutely not. And the reason for that is you're not stimulating the immune system, you're activating the macrophage. So the macrophage is in charge of the immunomodulatory functions. That's proper up and down regulation of the immune system. So if the immune system is overactive, as in autoimmunity, an activated macrophage will appropriately address that problem.
Right.
If it's underperforming, as in a degenerative process like cancer, then it will upregulate, the inflammatory response. So by activating the master regulator of defense, it's not stimulating the immune system. Because, for instance, people with autoimmune disorders, that's where the immune system is attacking you. So what they do is give you immune suppressing drugs to reduce that effect. Well, the problem is that makes you susceptible for everything.
Right.
So instead of doing that, activate your macrophage, and then it will manage the proper up and down regulation of a normal functioning immune system. So no, you can't take too much. You can't. It's not a stimulating. It's an activating immunomodulatory function.
I love this. Someone just sent me a message. Is there going to be a transcript on this? We'll definitely have captions, when we post a replay, and we usually do a summary, but there'll be closed caption, a summary. You are welcome to play it back for a transfer. We might be able to do it for this because there's so much science behind it. And I really want you guys to understand everything so that you can share your knowledge with your community and the people that in your life, like with your friends and your family, because this is just something that not enough people know about yet. And we want as many people as possible to learn and understand this. Yes, my brain is exploding.
I know it's difficult because there's so much science, but it's as simple as supporting the body's design of life.
Yes.
And if you can find, it's interesting that the father of pharmacology was a man named Paracelsus. Mm-hmm. And in the 1600s, he said something very profound. He said, everything, not some things, everything that man needs to achieve and sustain health is provided by God in nature. It's the job of science to find it.
Yes.
And that's what I think we do better than anybody in the world. That's what our team looks for. That's what we do. And when you do that, it is shocking to, like, the medical community, the capacity of the human body to actually heal itself.
Yes.
From conditions that medicine really doesn't have any good solution for.
Yes.
Like,
and it's funny that you pointed that out, but it is shocking. It does shock the medical community when we find something that's available in nature that can help resolve a problem that medicine couldn't. So Sam, let's talk about some of these products, that you put AceMan. Let's talk about what you are donating to all these children in the world. Let's talk about that in different ways that people can help support and how they can help support themselves by using these products.
Well, we have a product. We put the AceMan into a capsule. We call it Immune. So that's pretty easy. But the second thing we look at is, and it kind of goes back to a previous question you had, what causes the body to break down? In other words, all health starts and ends at the cellular level. Mm-hmm. What causes a cell to go bad? And it's really just a handful of things. Number one, too many toxins in the body.
Right.
More than the cell has the capacity to deal with.
Right.
It converts toxins into what are called free radicals that attack your DNA. Yep. They attack your mitochondria, the engines of the cell. Mm-hmm. And if you don't have enough antioxidant protection, then it gets the upper hand. And once it destroys DNA, that's the beginning stages of cancer.
Right.
So everybody's got damaged cells in their body. Some people become clinical events with cancer. Some don't. Right. Those that don't generally have a better functioning immune system. But you need the best antioxidant technology for the world that we live in today. We found the best class of that comes from pine bark or grapeseed. They're called proanthocyanidins. Mm-hmm. And the most potent of them comes from New Zealand, from a pine bark extract there. So we license that because these scientists love our project. The fact that we're providing their technology to the world's most vulnerable children, Another ingredient that we accessed is the best way to reduce the biomarkers of inflammation. You mentioned turmeric a minute ago. Mm-hmm. Its active ingredient is curcumin. Mm-hmm. In a test tube, it's wonderful. In the human body, not so good. And the reason is because it's not very bioavailable. Right. Your body can't absorb it.
Right.
So the most potent way to reduce inflammatory biomarkers is actually a molecule from the beet, and it's called a betalain. And you can just Google it and read all about it. We have a patented extract of betalains that is shown to be the most potent. And again, we got the science group that owned it to donate it to us. Why? Because we're a social business meeting the needs of children. That is a product that we call Limitless. And so people that are struggling with joint issues, that would be a product to consider because it's the most potent way of lowering the biomarkers of chronic inflammation with natural, non-toxic molecules.
Yes.
And then finally, we take all of these ingredients, the aloe vera AceMan, the proline, which is the beetroot extract, the exgenol, which is the pine bark extract. Mm-hmm. We blend it into a base of nature's most potent antimicrobial. So antimicrobials mean that viruses and bacteria can't live in its environment.
Right.
And that's actually a food ingredient. It's called Manuka honey.
Yes. Best.
And so it not only tastes good, it makes a great base. Mm-hmm. So we do a chewable where we put all of those into one because what we were looking for is what is the single most important product that a person could take to maintain optimal health. And we call that product Cell, C-E-L-L, Celebrate. Because literally your cells will celebrate with that intervention. Because it protects them from oxidative stress.
Yes.
It lowers the incidence of chronic inflammation, and it optimizes the immune system's ability to protect that cell. So that's what we do.
So this is incredible. We've already had a couple people say that, these products are life-changing. So blessed to have them in my life. What honey? It was Manuka honey. And someone asked about black pepper. The oil from black pepper does help make the curcumin more bioavailable.
It does.
For that question. So that's why it's commonly put together. So, and absolutely you can't supplement your way out of a poor diet because that's what we talked about, earlier, that it's really about optimizing your body holistically, whole body, mind, and soul. You guys know I talk about Reiki and energy as well. That's, this foundation of my practice is really addressing everything from your food to your nutrition and your knowledge to your energy. So Sam and I talked about, how important it is to also have to reach for whole foods and just make sure that you're eating good quality produce, good quality foods, and movement and mindfulness and meditation. They're all important for optimizing your immune system. And Ace Mannan here is something that is profoundly helpful for optimizing your immune system. Has so many healing abilities as well. So, and Courtney completely saved my life, and she's only one of so many out there. So Sam, I think, you're spinning right now, so hopefully your Wi-Fi is back on. You guys let me know if I'm blurry, if I'm pixelated, or if it's Sam. And if that's the case, let him know so that maybe he can move to a different area. Okay, now you're back. Yay!
Yeah, something came on my screen. I tried to wipe it off and it disconnected me.
Okay, good. Okay, no, that's perfect. So Sam, where can everyone go to first of all, find these products, to find more information, to learn how they can be a part of this social business structure that you have so that they can share this knowledge, and if they, and I'm always encouraging people to help and support. So whether or not you do that through donations or you do that through being a part of this network, these are ways that you can help support not just yourself, but also these children and just this mission to help as many children as possible who are of the greatest medical need and they're malnourished. So, So Sam, let everyone know where they can find information, website, handles, all of it.
Okay. So first, for MannaRelief, that's MANNA Relief. You just go to MannaRelief.org and you can sponsor children overseas. You can sponsor a medically fragile child right here in this country to get the intervention in conjunction with whatever their standard of care treatment is.
Yeah.
And so that's MannaRelief. And we take donations, and that's how we live there. The second, if you want it for yourself, which also generates a donation, you can go to alovea.com. That's A-L-O-V-E-A. A-Love-A. So it's alovea.com. And you can read all about the technologies. You can find our unique products online, and you can actually purchase as a customer, which generates a donation to a child in need someplace in the world.
Yeah, it's beautiful. So beautiful, Sam. And for those of you that have sent me questions, because it sounds like there's a lot of people that want to know more about Sam and all the research you've done and the background. Do you have a personal website, or where can people find more about you, Sam? And just, I know that you've written papers, you've done talks, can they find you on YouTube? Like, where can they hear more about your knowledge and everything that you've learned and the science that you're sharing today?
If you go to Alovea Library, I've got a series, so alavea.library, I've got a series of videos, on macrophage activation with Ace Manna and its role on cancer, activation of macrophage and its role on viruses, social business, inflammation, things like that. So there's a series of videos in that library.
Amazing. That's perfect. And I know, and so you guys go to alavea.com to the library section and you'll find all those videos. And I know that we're coming up close to the hour, but I would say that one of the questions that we were sent in the most was really about Ace Manna and COVID. And I know that we talked about it just briefly, maybe about 20 or 30 minutes ago, but if you could share a tiny bit more. I love these comments that are coming in. Yes, Sam is amazing. The library going to share. Thank you so much, you guys. But Sam, is there anything that you can share about that? Sure. Just because it was asked so many times.
Yeah. So the immune system is non-specific. In other words, it doesn't recognize COVID from influenza, from Epstein-Barr, from any of the viruses. It just recognizes viruses.
Right.
So you can put any name before the virus that you want to, and the immune system responds exactly the same way. It sees the virus because of its cell surface glycan structure. Those are little small strands of sugars that stick off the surface of a virus, a bacteria, or an aberrant cell, which is like a cancer cell. And it tells the immune system there's a problem. Okay? And so when Ace Manna goes into the body, it activates those same immune cells to more effectively reduce the effect of the virus on the body. So I was just quoting a paper that was done with Ace Manna on influenza. And again, you can put any name before the virus that you want to, but what it does is it suppresses the adhesion because the viron has to attach to a cell and then penetrate. So number one, it reduces that. Number two, it reduces the viral load of that virus in the body because that's what the immune system does. And then number three, it protects against the most severe responses to the virus, like the cytokine storms, because it modulates the body's response to that viral infection. And so that's how Ace Manna intervention helps with any kind of viral infection. Is its mechanism of action is identical for all of them. Turn on the immune system, optimize its response to viruses, and it will do what it's designed to do.
Absolutely. And thank you, Sam. Thank you. Someone just said such great information. It has been an hour of just incredible information, Sam. Thank you so much for sharing this with us. I really wanted the audience to meet you and to just understand what you're doing and what you're creating. And how we can be a part of that, and how we can help you on this mission, and how we're helping ourselves as well with this information. So you guys, we're coming up to the hour. I just want to remind you again that it is MannaRelief.org, O-R-G, so MannaRelief.org, and then it's alavea.com, so ALOVEA.com. And if you go to the library there, you'll find all these videos that Sam has recorded. It's just so informative to really break things down again in case this went by a little quick for you and you just want to recap. You can find information in his library series, right, Sam?
And let me just say that it's Alavea Library to get into the library. You have to get Alavea. So it's a different site.
It's a different site. Oh, thank you for that. I misunderstood. It says Alavea Library. Thank you. So maybe someone can just type that into the chat real quick so people can see that it's Alavea Library and that's where the series will be.
Right.
But just go look all this up. Make sure you go to the account. They have a couple different accounts. They just started this one that we're on right now. Go support. Follow Sam, follow Alavea, follow MannaRelief. Just go and check out all the information. They're doing such great things, and you're helping not just yourself, but you're helping some incredible children out there that are needing our help. So we'll probably do this again, just to
let's do it again.
Yeah, let's do this again, just so we can give people more information. I'm sure people will go online and have questions. so we can do this again. But you guys, thank you so much. Send Sam questions. He's learning Instagram, so he'll go and check them out.
This is new.
Give him some homework to do.
I know physiology. I don't know Instagram.
Well, we all have homework, so we're gonna go all look up this stuff and look up Alivea and look up these products and how we can help. Sam is going to look up Instagram and figure out how to answer your questions directly. And we will do this again soon, you guys. So thank you so much. Thank you for always being so engaged and sending in your questions and, and participating here. I'm so humbled by your energy and appreciate you all so much. And thank you so much, Sam. Thank you for giving us your energy today.
Goodbye.
All right. Bye, guys.